Good afternoon and welcome to the December 9th meeting of the Pitt County Department of Social Services Board. I'd like to observe a moment of silent prayer or meditation. Okay. All right. I checked to see if there were any public comments, and no one has signed in. We again want to remind all our citizens that this is a time to address the board, and we sincerely hope you take advantage of this opportunity. Next, we're going to move to adopt or revise today's agenda.
Mr. Chairman,
Yes.
I recommend that we move the readiness report into the closed session.
A motion has been made.
I second the motion.
Motion has been made and seconded. All those.
Mr. Chairman,
Yes.
can I interrupt? May I want to ask the county attorney if that's an appropriate closed session item?
Yeah.
You may, and I guess tell me why you would want to go into closed session. You may go into closed session, excuse me, for, to discuss the terms of a contract, to discuss a personnel issue, to discuss acquisition of property, or to discuss information that would otherwise be confidential under the law, such as recipient information or protected health information. So I guess I would need to better understand your basis for what ground. There are only 5 grounds within which you can go into closed session before I can advise you on that.
Okay. Yes, two of those reasons are issues that we would like to discuss in closed session.
Okay, and then when you make the motion to go into closed session, if this passes, just be sure to recite those by the statute.
Okay.
Mr. Chairman, I move we approve the agenda as presented with the corrections, with the changes that have been made.
I second.
Okay. I need to add two things in myself. One thing is the status of the interim director, where we are with that, and also status of the permanent director. Okay. Would you
And
accept
include those things also, Mr. Chairman.
Acceptable.
Motion has been made and seconded. All those in favor?
Aye.
All those opposed? Okay. Motion has been made and seconded. Next, we're going to look at the minutes of the previous meeting.
I move the approval of the minutes as made, Mr.
I
Chairman.
second the corrections.
Okay. Motion has been made and seconded. All those in favor say aye.
Aye.
All those opposed? Okay. Next, minutes of the call meeting. All those in favor? Excuse me, I jumped ahead. I'd like to get a motion on that.
I make a motion that we accept the minutes of the called meeting.
Okay.
Second.
Okay. Motion has been made and seconded. All those in favor, say aye.
Aye.
Aye. All those opposed? Next, we're going to move down to matters which require board action. And the first one will be with P.J. Quinn, Business Officer.
Yes, sir. We have several budget amendments, and I'd like to go over each one of them, and then at the end, make the motion. The first one, we received a grant in the amount of $5,552 from for emergency food and shelter. And we've received this grant in the past, but we were always able to use it before for utility work. But this year, the $5,000 has to be used for rent or mortgage help to our clients. We also received $5,300 from Aden to aid the citizens of Aden with utility assistance. I rolled the remaining balance of the Greenville Utilities donations that we had from last fiscal year. I rolled them into this fiscal year to allow us to go ahead and completely spend those. If we didn't do that, we'd have to send it back to Aiden. And we've received $5,888 for Energy Neighbor Funds, which is also utility help for eligible citizens. And then the last thing was we had an increase of $1,727 in the LEAP program that we've been talking about to help citizens with their heating needs. And that's what we've gotten so far.
That's really great that we have, for lack of better terms, free money, but money coming in is very good.
Mr. Chairman, I move that we approve the budget amendments, the 5 that has been presented.
I second, Mr. President. Mr.
Motion,
Chairman.
okay. Motion has been made and seconded. All those in favor say aye.
Aye.
All those opposed? Yes.
No, I'm not opposed.
Oh, no, I thought you had.
I do have a question.
All right.
Anybody that's north of the river that lives in Belfast know that their water bill and sewage bill is approximately $100 for every household. And some of us have been very much concerned. As a matter of fact, our attorney even called it Raleigh pertaining to this. There are many families there that really do need help, assistance. And I don't know, maybe you all or we, by calling up Greenville Utilities, if we could get them some help, because they do need it. Because you have a lot of people there that are low income, it's a low wealth community, and
No businesses.
there's very little business there. And I don't know, it might be just a waste of time, but at least we could attempt to give some of them a relief that are in great need.
As I understand it, they would need to apply for the energy assistance, but seems like you're talking about maybe something a little more
Yes.
directive that we might want to do to help that group, and I think that's a good
Water is
idea.
not-
Yeah.
And we'll take that up. I think
Okay.
that's a good idea.
Water is not energy.
Right, we couldn't use the funding that we have here to help pay for water bills. They won't allow it.
Well, it's a combination of water and sewage.
Neither one. We can only use
Yeah.
electrical, heating and cooling.
That's the reason I said Greenville Utilities. And Scott, you know, I know Janice, when we called up Raleigh pertaining to that, of course, we didn't get anywhere.
Mr.
But,
James, you'd asked me to look into this a while back, and I had contacted the town manager, Todd Bullock, and basically, the town of Bethel does receive utility service through GUC, but the town of Bethel sets their own rates. The improvements they've made in the town with water and sewer have been made through grants and also through, I guess, their ability to finance those improvements. And the rate structure they've set up is basically what they charge the households is what it takes to retire the debt and pay for the system. They're just buying service through GUC, but the town itself sets those rates. So, I mean, GUC really doesn't have anything to do with what the town charges. They just buy the service from GUC.
I think we're going into a different area.
Yes.
Probably what we need to do is hold that and then go back into that at some point and really examine that, because that's something very, very different. But I think that's a good idea that we can help a group that is really being affected by some of these bills. Okay. Next, hey, did we vote on? Yeah, we did vote on
We
it.
voted on it.
You did?
Mhm.
Oh,
So now
okay.
we're down to the reports to the
Okay,
board.
next we're going to go down to reports to the board, and that'll be Brian Everett with the first quarter statistics.
I'm going to go first with the
Oh.
Services Division.
Okay.
First, I would ask if, in reviewing the report, if there are any areas that you particularly want me to pay attention to, or that you have questions about on the quarterly report. And then just a couple things I would share with you, if you have anything that stands out to you in the terms of the numbers.
I didn't see any
I
numbers.
didn't see
There are no
anything.
numbers.
On the on the second page of the report, I'll just share with
What
you.
page you at?
The second page, where the objective is children and families living in a safe and stable environment. If you look down to the third indicator, number of CPS courtesy requests from other counties and states, and the last one, number of CPS in-home courtesy reports from other counties and state. Just sharing with you that this number has really increased for us in Pitt County. You probably are aware that Pitt County Vidant serves 29 counties in eastern North Carolina. Often, children end up at Vidant Medical Center, especially now since we have a children's ER. So we've been working with Vidant Medical Center to look at the possibility of them funding a position similar to what we do for our adult APS guardianship position. So we made a presentation to them and shared our numbers, because we track where all our referrals come from, where courtesy requests come from. So this is a lot on staff that they are doing on behalf of other counties because we have the medical center here. So I just wanted to bring that to your attention, because our numbers certainly have increased in both of those areas. And on the second page after that, if you look down, number of adult cases declared legally incompetent and guardianship managed by the agency. This is another area where it's in the middle of the page.
41.
Pages aren't numbered, but
The pages are
40.
number.
This number 40. And mine's
your
number.
page number.
They're
On the
all numbered.
side.
I said they
Yeah.
were numbered. She said they weren't.
Oh, number 44. I don't have those numbers. Number page
Number
44. In the middle of the page, number of adult cases declared legally incompetent and guardianship managed by the agency. We've seen a significant increase in the last 2 to 3 years in the number of guardianship cases. So we are in the process now, I guess especially going into budget, to really assess our capacity for continuing to take on guardianship cases as a county. So just putting some light on that a little bit, and kind of setting the stage for maybe a discussion as we go in after the first of the year to look at budget, and we'll give you some more data around those numbers. So just a couple areas to pay attention to.
All right. I had two points. On page 39, I'm wondering with the increase of child cases that we're seeing in this county, and you're looking to fund a position and maybe have Vidant do that? Is that what you were saying?
Well, we were looking specifically at the number. Yes, our reports have increased, but what's increasing is what we are being asked, our staff in Pitt County is being asked to do on behalf of many of the 29 other counties in eastern North Carolina. Short of sending them each a bill to help pay for.
Yeah. I
But,
was
we would
wondering
really
what-
like to coordinate and looking at the possibility of actually having a social worker, CPS social worker stationed at the children's emergency room. So just kind of letting you know what we're talking with them about and looking at the numbers. That
I was
really-
saying, yeah, that's a good idea, because there is an adult person there that is stationed in the hospital. I'm wondering would a letter from the board be helpful at this juncture to the hospital?
Yeah.
What do you think, since you've been involved in that? Would that be helpful? If not, then that would be fine.
I
And we
guess
could wait until later.
maybe we
Okay.
could put that, table that until after the first of the year.
Is this?
I have two comments. Number one,
Let me.
Okay, go ahead.
The other thing that in my other life as a psychologist at the hospital, I've seen it, and I do a good number of the capacity evaluations. I've seen the request in the hospital go up a good bit in the last last couple of years, and we're seeing that among the staff, not only inpatient but outpatient as well. So we're seeing that as well.
Yeah, we have I think overall, a very good partnership with the hospital. And I think on both sides, we agree that this would be a very positive move, very beneficial to the hospital as well.
Okay.
all right, now I have two comments. All right, the hospital is in charge of 29 counties, as you said. This brings lots more of these cases to us. Now, they need to work out a system just like they have with the nurses in the public schools. And this extra work that's being done, certainly we need to write them a letter, and I believe that they would take and cooperate and put the extra social worker wherever it is needed to get these extra cases that we do have. I think that is very important. The next thing I want to know, Margaret, on the guardians, people now, are wanting to stay at home more than ever before, the elderly people. Isn't that correct? And isn't that the reason probably they have more in this particular program?
Well, in terms of the guardianship, those are certainly people that we are either guardian of the person and/or guardian of the person and the estate because they have been declared incompetent. So some are at home, some are in placements in adult care, so it's a variety of things. But after, certainly after that competency hearing, we look to see what would be the best placement, whether that would be home with support or in a care facility.
Yeah.
So, but the number of those cases in and of themselves in Pitt County, as you can imagine, as the elderly population increases, we have seen a definite increase in that also.
Right. Well, I'm very much interested in that because I stayed in the court for almost a day on this very thing that you're talking about. And I didn't agree with social services on it either. And of course we hadn't, so we won out. But I think everyone who is in charge of that program needs to get in there and know what's going on. You're probably familiar with the case I'm talking about, but that's beside the point. But anyway, I think because the more people we can get to stay at home, and if they have a little care, good care, they're better off. And there's no question about it, that it's much cheaper if they can stay at home than it will to go into a nursing home. And we might as well face it. What percent of the nursing homes in Pitt County that are there by private concerns? So as many as we can keep out, the better off we are. That's all I got to say, Mr. Chairman.
All right.
Having seniors in the home is really better on the family, I would think. My question is, I'm curious about school social workers. Do they fall into this, or where does Garden Enlighten fall in? I don't have a social science, but
You're asking me about school social workers?
I'm asking about, is that a part of this, or is it
No,
Garden Enlighten? I'm just curious. Because aren't there school social
Because
workers?
I guess my understanding
know
is
whether-
from, are you talking about for children or for adults?
I'm talking about children.
What we're talking about is that these are people that come to the hospital, and then for
Okay.
some reason there's a concern about their care. That's what you're saying?
If you're referring to adults, yes.
Right.
People that, like CPS.
Well, see,
Adults can be abused, neglected, and oftentimes exploited.
the reason I brought the question up was because of the departmental goal. It said children, and I just was curious about that. If it doesn't fall into that report, then disregard it.
Thank you.
Okay.
Okay. For the Income Maintenance Division, if you would please look on page 46, which is the child support program. Our goal to increase is to have the percentage there met. This is a state requirement. They give it in a percentage, and of course, we have assigned a corresponding number of cases, that the total number of cases. But in this situation, the annual target is 88.36%. And as of the end of the first quarter, we were at 87.31% with 7,547 cases under order out of 8,644 cases. So we have, at that point in time, we had 8,644 child support cases with 7,547 actually with orders to collect child support. The total child support collection for the first quarter, July through September, is $3,292,413. We'll be better able to know how we're doing at the end of December with 6 months of collections. We always anticipate greater collections in the period January through March and even April, because that's when people get income, federal and state income tax returns, and we are able to collect from those tax returns. So we expect a greater amount of collections after the first part of the year. But our annual target is $14,056,062, and as of the end of September, we had collected $3,292,413. On page 44 is the Medicaid processing figures. We do get a report. We do still get a report card on how we're doing with Medicaid processing. The state requirement is 90%, and if you look at that report, medical assistance to the disabled, those applications we processed through the end of September, 88% timely, or 559 applications. All other Medicaid categories, which is all other adult programs, and which also includes family and children's programs, we processed 84% timely, a total of 2,003 applications in that 3 months period of time. And then the final column at the bottom, that's the North Carolina Health Choice Program for children. We processed 88% of those applications timely, or there were a total of 93 for the first quarter. So that's my overview of figures for the Income Maintenance Division.
I have one comment. One of the things that we had talked about, just to be sure this is the right, this is how we're collecting the child support, and this is also as part of the program that we had that has been very aggressive and very good in the past from what I've seen.
Yes.
And so are you planning to roll that out again in, I guess March or whenever?
That
Or do you
was,
do it once a year?
that was a program, in conjunction with the Sheriff's Department. That is done one time per year, yes. And they do plan to do that annually, whereas they make an effort to try to locate individuals so that we can actually collect and get orders in place, and for orders that are in place where people are not paying, to try to get those started.
Okay. Did you, I can't remember, I know I had mentioned use of an amnesty period. Was there an amnesty period in that as part of it also, or not?
There was a period of that in that program where if people would come forward themselves, they would work with them to try to set up a way to collect the money without having to be arrested.
Okay.
Yes, there was a period that if they would come forward and put something into place, they could avoid, what would come later.
Okay. That's a really good idea.
Brian, I have 2 or 3 questions. Number one, you have in Pitt County 7,547 people who are supposed to pay child support. Is that correct?
Those are cases on which we have an order in place that are
Right,
paying.
that's what I'm talking about. They have to pay. All right. Out of those, what percent do not pay?
I couldn't give you that figure, but I can get that figure
Yeah.
for you. I'll be
Okay.
glad to get it.
Good.
I don't have it here,
don't,
but
but,
I can get that for you.
All right, the next thing you realize, of course, the federal government is going to cut back on low income taxes for those people that get, the about $4,000 what they paid in the income tax here, they're not. So I understand. Probably the state will do that also, so that's going to affect the income that many of these broken homes will get.
Right.
We hope that it won't happen, but I know it's in the works on that.
Okay.
For that. Of course, anybody that keeps up with taxes knows that too. But it's something that we all got to be concerned with, because these mothers, they need the husband. There are husbands that get child support.
Correct.
Certainly.
And those people that brought them in this world, it takes 2 now to pay their part of it.
That's correct.
Okay.
Okay. That's
And,
all I
and,
have to say.
and again, I really like the aggressive stance the department's been taking on that, especially in terms of the sheriff's program and the publicity that went along with that program. Okay. Next, we're going to the holiday cheer.
Everybody got to go to Santa's workshop or is busy out there with Pitt County elves today. But everybody wanted me to let you know from the services division as well as the adults side of it that we have an extremely generous county to help out with holiday cheer for our foster kids as well as adults that Cynthia has told you about before in our adult care homes. However, there's still time to get in on this holiday cheer. We always have kids that are coming into care at the last minute and adults that are being placed in adult care homes. So I think Susan's going to put up the address where you can send the donations to. Mildred Daniels, as you see, to our address, and here's her phone number is 902-1134. And Retta O'Quinn for our adult holiday cheer program, or Tammy Corbett, up on the screen. And of course, our address, if you wanted to send it in, is 1717 West 5th Street, zip 27834. So, again, thanks in advance to our county, who is just fabulous. There was a couple toys I wanted to bring to show you today, but I was told no, so sorry.
One of the things I may be speaking a little prematurely, last year we did, I think we took on a couple of children. I'll poll the board, I think hopefully we'll be able to do that this year as well. I'm seeing a lot of yeses, so I'll be following up with you about perhaps.
I'll see you after the meeting. No problem.
Okay. Do I get to play with the toy or not?
It's right outside.
Okay, all right, okay. Okay. All right, next we're gonna go to
Leah.
Okay, Leah.
Okay. The Low Income Energy Assistance Program, or LEAP program, started December 1. We are located in the old Strive building this year. We're off-site. We're at 1710 West 6th Street. We're also partnering with Council on Aging to take applications also. And just so that you'll know, there are several Council on Aging agencies located in the different townships and municipalities across Pitt County. Council on Aging, when they set up an appointment with the elderly, they are allowing the elderly to come to the Council on Aging building, whether it be Bethel, Farmville, or wherever. Once that appointment is made with them, they will come to Council on Aging in that town and take the application. So that will help us somewhat in the elderly all the elderly not having to come in to Greenville to our 6th Street location for applications. So we've added that this year. The LEAP program provides a one-time annual vendor payment to eligible families to help with their heating expenses. And right now we are taking applications in our priority group, which are citizens aged 60 years or older, or who are disabled and receiving services through the Division of Aging and Adult Services. These individuals can apply through December 1 through January 31st of 2014. And disabled persons are defined as receiving SSI, Social Security, or VA disability. Once the target population has been served, we will take applications from anyone starting February 1, 2014. Anyone can apply. But I wanted the elderly to know that if they miss that date of that time period of applying December and January, they can still apply beginning February 1. So that's important. Their time frame does not stop at all. But this is just a period of time that is set out for them to make sure that we use as much of the funds that we have toward their needs being served. This year, we received $1,136,927, which is almost twice as much as we received last year. So we're hoping to serve as twice as many folks as we were able to serve last year. The program will run from December 1, 2013 through March 31st, 2014. We ask that all folks who apply know that income verification is a must for all applicants. And when you come in to apply, you need to make sure that wages that were received in the month prior to your applications, that you know what those wages were, or the gross amount of your Social Security benefits or your retirement benefits. We need to know whether you receive child support, and any income that you might receive that is coming into your home. We need the name, dates of birth, and Social Security number for all household members, and proof of how you heat your home, who provides you with your heating sources, and your account number that you have with them. And we need to know everyone that lives under your roof. So these are some of the things that we will need to know when you come in. I am taking telephone applications for folks who cannot come in because of maybe they are ill, or they've just, a lot of calls that I get, people have gone through surgery or had a stroke or whatever. So I do take telephone applications. But with the telephone application, I have to mail the application to you for your signature before we can process your application. And once we get your signed application, we will process your application, and then we will send you a letter back telling you how much you're eligible for, or if you're eligible for the program. So those are the basics of our LEAP program this year. Again, we're located at 1710 West 6th Street, the old Strive building, and the phone number where we can be reached is 252-902-1110. And we are partnering with Council on Aging, and they're located at 4551 County Home Road, Greenville, and their phone number is 252-752-1717. And we have tried to advertise as much as we can. Channel 9 has run a segment on the LEAP program, and the Daily Reflector also did an article in their newspaper over the Thanksgiving holidays.
Gwen, you mentioned that you are taking applications. Do you mean you personally?
Yes,
Do the folks know how to get up with you?
yes. They have been able to reach me through our phone line or through the telephones that are at the Strive building when people call in to ask about an application. And the folks at the front desk, I've also met with them so that they will know who to send to me for a telephone application, and to the questions to ask to know what folks I can do that with. I can take telephone applications, but we are limited in how we can, we don't have the capacity to be able to get all of that mail in and out. We don't have the people that can do that for everybody. So we are selective about what your reason is that you cannot come in.
And you
to make
kind
an-
of determine that. There's not a set standard
No.
of, okay.
We determine that based on what folks call and tell us. I can't come in. My husband had a stroke. I had a heart attack. Recently, I'm recovering. I can't sit and wait for a long time. I have an oxygen machine or whatever. But I will gladly take an application.
Can family members come in?
Yes, family members can come in and take an application for you. we ask that that family member write out a note that just says, my daughter has permission to do a LEAP application for me, and just sign it. And they bring that note in, and we allow them to do an application for a family member. Yes, sir.
May I ask a question? Sure. Glenn, why can't you do this at all senior centers when they have certain hours of operation? I realize that. But why can't we have all applications for senior citizens pertaining that they could sign up for each of these programs if they so desire? Can that be worked out that way?
That could be worked out, but the issue would be whether we would have the employees, the number of employees that it would take to do something like that. Council on Aging has 2 employees that we train to take the application. They go through our training process with us, and then they go out to the different facilities and they take the application. The issue would be we would not have the capacity to have the number of employees needed to put someone at each one of those sites.
All right, but this is what I was talking about. Each one of these senior centers has a person hired to take in for the exercise. I think they do.
Yes, sir.
Exercise and things such as that. Could you not train that individual, or is it too complicated? Could
No.
you not change that individual to fill out these forms so that they would have the experience?
We could, but what, I hate to say, but the issue again would be they can only take the application, they cannot determine eligibility for the program. So that means the application still has to come to social services, and there has to be someone who can determine the eligibility and get back with them within the time frame that's required. Because there is a time frame in which to determine eligibility.
Yeah.
So if I don't have the folks on board that can process that application, even though I have it, I'm still going to be at a loss of processing everything timely. That would be the issue with
Yeah.
it.
Well, my concern is you take people at Bethel, Chicago, Shelbyville, all in that area.
Yes, sir.
They're a long ways from Greenville.
Mm-hmm.
And they are the ones in many cases that need help more than anybody.
Right.
They're the low wealth ones. And we need to find some way that we can reach those people.
Mm-hmm.
I think that's one of our jobs here, is to serve those who really are in need.
Right. And
So
maybe,
I don't have the answer for it, but
Right, I
I
know.
know it's something that, and Pitt County is a big county. It's something probably that we need to take into look at.
and
how to
maybe
reach them.
next year, prior to the program, we can work on something like that, Mr. James, and
Okay.
work on getting, and we had talked about that this year, but again, remember this year, we had to move the entire program from one building to another. And that also limited the time to prepare to get things, like you're saying, satellite locations done and those kinds of things, because of actually physically moving the program from one building to the other. That took some time. But I understand exactly what you're saying.
These people that I'm talking about that are in these local senior centers, they know the people.
Mm-hmm.
And they know a lot of them, some of them live that around there. They know a lot of them personally, of course.
Yes, sir.
I think it's something we
How-
need to
how-
do.
Did you have? Were you
Yes,
gonna say
Mr.
something?
Chairman, yeah, I wanted to suggest that staff recognize the building right now on 6th Street, there's no signage identifying it as the LEAP program or DSS or anything.
We've asked.
Even the old Strive sign is off the building. We need, for the public's benefit, we need to identify the building as LEAP. I know it is temporary rental, but you'll get Buildings and Grounds, they can put a temporary sign
Okay.
in front of the
That would
building.
be good.
We have already requested that, Mr.
Okay,
Elliott.
great. Thank you.
Okay, that would be good.
Gwen, how are the people in Grimesland served? They're more than 16 miles away.
Okay. They are served the same as any, I mean, we
Do they
haven't,
have a council or agent down there?
I believe there is a council on aging in every one of the townships. I know there's Grifton, there's Aden, I'm not sure.
Just only
I'm
a
not
few
sure.
of them, not all areas are served.
I know there's one in Grifton, no, there's one,
Grifton, Aden,
Aden and
Well, I know
Bethel.
Grimeston
Bethel
is
and
about,
Grimeston.
Fountain's got a good one.
Right,
well, the Grimeston is about the only one I can't
right.
recall one
You got
for.
Stoughton, Pactola, a lot of people live out
Right.
there. Almost to Washington.
Yeah.
Pitt County goes up to almost to
Yeah, that's why I was
Washington.
talking about Grimeston.
Yeah.
Yeah.
Well, that's on this side.
Those are the ones that are
Other side,
handicapped, homebound.
Right. Well, the homebound folks are being, if they have a social worker that is assigned to their case that is working with them, those social workers are, when they go into the home to see the folks, they are taking their application. So if they have a social worker assigned through them, through adult services, those social workers are trained to take the application for the clients. So we've done that also.
So they're kind of the same, and you're using the social workers that would go out and see them
Yes,
to do that?
to
Okay.
do that,
That's a good idea.
to take applications on their own caseloads.
All right, okay. All right, I guess what I'll do is do the interim and permanent director after yours, or do
Okay.
you want me to do it before?
I'll go ahead and invite you in.
Okay, all right.
On
Next we're gonna
NCPA's
move to the
update,
director's report.
part of it is in the readiness report. On the backlog report, we have, as far as the redeterminations, we have caught up on the redeterms. Mr. Knight and his group are working on December the 21st and working on January redeterms, so we are in pretty good shape on the redeterms, which I appreciate the hard work that they have put in on the redeterm group and getting that accomplished. We are still working with the groups on the backlog, and we'll give you more information on that. If you look at the status of agency personnel, we have 17 vacant positions. All of them have been unfrozen except one. That's a retirement in January the 31st, 2014, daycare worker. We have quite a few positions that have been filled since the last time. All those positions have been filled with individuals and work against, so those individuals do not know anything about policy, so they're having to learn the program as well. One of the individuals that were supposed to start the day called and decided that she preferred to do something else, so she did not report to work today, so that position will go back. And we'll be looking at some of the other individuals that we had that applied for that position. So we, as far as the income maintenance portion, we are looking good in getting those positions filled. We have in the services division, we have some majority of those positions in the screening, and they will be in the process of interviewing. And we have one that we're working on the reference. So I think we're making good progress. But like we say, when we bring somebody in and to work against, they have to learn the program. So there's a downtime in learning the program.
These in-house promotions are, as always, I ask that question about in-house promotion and opportunity to advance
Yes, we
on
still.
staff.
When we advertise our position, we advertise in and out. So for these positions, we have nobody that applied in-house. So that's why.
They're all out. I didn't want to call it out.
Yeah, right. I mean,
almost said
Outside the agency.
outside the
wrong
agency.
term.
So those are individuals coming in outside the agency.
Outside of the agency.
But we did apply in and out. When we advertise our position, we advertise in and out. And then they have individuals in the agency that apply. Then we look at them, and if they are the ones that but majority of the people that we have already in-house, they're already doing income maintenance casework, except for a few in the clerical division.
Okay. All right, you had a question?
Yes, now's the opportunity for us as we hire new people to make sure that we get those people that are qualified to work for us in the future. We know that things are changing, and they'll probably be changing more now than ever before. So I think when we fill a position, we ought to make sure that we get somebody that that would be a benefit to us.
Well, we're trying, Mr. James.
You are, that's good. All right, but I mean, that's,
We're trying, but individuals
sure.
got to be committed once they come here to the job. And only thing that we can do, we can give them opportunity to work for Pitt County DSS, but then they got to put the effort in to learn the program to be good workers.
let them know that these computers now are very, very important.
That's what
Okay.
Eugene talking about.
That's what he's
Okay.
I certainly am.
Computers.
And,
All right.
and on the telephone report, if you look at the telephone report for the month of November, you can do a comparison and see that in October, the numbers are decreasing. We have went down roughly close to about 25,000 calls coming into the agency. So that's a good thing when you look at the numbers coming in and food and nutrition services and Medicaid. So by us being able to do the reader terms, that's helping a lot in Medicaid. So I think that's good that we're seeing a decrease in the number of calls coming in through the agency.
That is good.
Yeah, because when you go back to, from June through October, where the total higher number of periods,
Yeah.
and you look at where those decreases
Yeah.
went on, you had the food nutrition services, Medicaid, and child support. Those are the ones that certainly contributed to the decrease of calls.
Yeah.
Okay. Thank you for that. Okay. Now, I just want to say where we are in terms of the,
Thanks, County Commissioners, for unfreezing positions.
oh, yes. I was also going to thank the county commissioners for unfreezing the positions, and it seemed like we know somebody there. We know somebody that's over there, the guy with the dollar sign, so thank you very much for doing that. Just to mention the fact, there were 6 new people started this month from the list that I saw, which is very good here at the bottom. So thank you very much for doing that. Now, in terms of where we are with the fulfilling George's position as he retires, in terms of the interim person, we have a committee and we're working on that, and we'll be interviewing a candidate today. It's a very strong candidate, and we hope to get him on as soon as we can. In terms of fulfilling the
What's that, excuse me, what did you just say?
as soon as we can, as soon as he's able to come on.
It would be effective the day
There you
after
go.
Mr. Perry
Then-
retires, because you couldn't
then
have an interim plus the permanent director at the same
Okay,
time.
I was,
But February 1st is what.
February 1st is
or
the date.
soon thereafter.
for the interim.
Correct.
Yeah, for the interim, right. And for the permanent director, we do have a job listing that we have, and I'd like the board to look at that. I think we've
Is
revised
that an
it.
in-house person?
No. Okay.
Mr. Chairman, on the revised job description, the committee had met on this, and you had asked me to review this with Florida Hardy, Pitt County's HR director. And there were a couple things that we did look at this
Okay.
and change on it, if I can point those out to you. One on the very bottom, on the deadline for accepting applications, it did have January 15th, but we felt that when County Lines is published, which is a publication of the NCACC, the North Carolina Association of County Commissioners, with a date of the 15th, I think we determined that they publish the first, but it's not mailed out until that first week. And if it's out, it really didn't make sense then for someone to have 7 or 8 days to be able to respond if they're looking at that ad. So we changed it to the 31st of January.
All right.
Also, when we send this ad to the NCACC, it will immediately go online and be sent out to everybody, all the managers and everybody, DSS directors and whatnot, who are part of that listserv with the NCACC. So even though this will publish in a paper format, in a printed format in January, it'll immediately go out there now, and they'll be able to see that the ad is out there. The other thing we changed about 2/3 of the way down, where it's underlined, where it says interested candidates must complete and submit a Pitt County application along with a copy. It used to say a certified copy, but we felt like with such a a close deadline on this in order to get a certified copy from a college university. Takes time, and also technically you don't need that certified copy until the point in which you're offering the job and you're certifying the person who's coming in. So that will happen, but we didn't see a need for it to be a certified copy at this point in the process. Florida, can you think of anything else we changed on this? Okay.
Okay, those seem good. I think those will work out, especially with the deadline. And what we'll be able to do is, after we decide about actually sending this out, this will meet the deadline of I want to say the 15th, is that correct? That we're looking at.
When will it that we will know who it is?
Excuse me?
When is it that we will know who it is? Or is that something that's kept within the committee?
Yeah, we'll be going over that, and then we'll be talking about what we're doing. We're bringing back the name, and we'll be bringing that back to the committee.
The intent, Mr. Chairman, as I recall, that the committee is going to bring back, well, on the interim, they'll bring back one name for who's recommended to be interim. Now, for the actual DSS director, the committee will bring back a slate of names, maybe 3, 4 names for you to consider, and then the whole DSS board would interview that slate of names for people to be, who are being considered for the position of DSS director.
I read the closed session being out of state at the time. I was wondering, when was it that as a board member, I would have privilege of knowing?
Well, if this closes on the 31st, the committee, I'd imagine, would probably meet that first week of January. The committee will have to vet through all of the various applications that come in, and then come to the short list of names to bring back to the full board. The chairman or the board could call a called special meeting of the board to deal with this. And you may want to do that to push this process along and to actually start the interviews as such, and maybe initially review the slate of names that are put before you. And
And a lot of that will depend on the number of people, things of that nature as well.
Right.
But in theory, since we meet on February 10th, if it closes on the 31st of January, you may have, by that board meeting on February 10th, an idea of there's 3 or 4 that the committee selected that then you'll set up interviews for,
Good point.
right?
Hopefully.
Hopefully that's doesn't give us a lot of time, but hopefully we would be able to do that. Okay. All right. Well, I'd like to get a motion on this ad in terms of it going out.
Mr. Chairman, I make the motion that we accept this ad for application for County Director, Social Services.
Okay. Get a
Second.
Okay. Motion has been made and seconded. All those in favor say aye.
Aye.
All those opposed? Okay. Motion has been carried. So this will go out, and this will, for lack of better terms, hit the wire on the 15th. Is that
Well,
what you're saying? When that?
The county's HR department will actually go ahead and mail this to the NCACC, probably effective this afternoon, so we can get it electronically out there on the listservs, and then for the publication in January in county lines.
Okay, that's what I was thinking of. So we're good with our deadlines and getting this out. Okay. All right, okay. You see, I guess we need to go into a closed session.
So moved.
Okay.
You need the motion?
Yeah.
Mr. Chairman, I make the motion that we now go into closed session.
Oh, you did that too.
I thought you said
Can you
so
second
moved.
that, please?
Yeah.
Yes?
Yes.
Okay, thank you. Motion has been made and seconded. All those,
Hold it.
Oh.
You're not citing the reason you're going into closed session?
Yeah.
That there's one of 5 reasons you need to cite that.
oh, okay. We do need to,
She always read it.
Yeah.
Yeah.
She always
She
read
needs
it.
to read it now.
I'm getting ready to read the closed session statute.
Which of the 5? There needs to be one, or you need to cite a specific.
Yeah.
Okay.
North Carolina General Statute 143-318.11 regarding closed sessions, Section A, permitted purposes. It is the policy of this state that closed sessions shall be held only when required to permit a public body to act in the public interest as permitted in this section. A public body may hold a closed session and exclude the public only when a closed session is required. Also, item number 1, to prevent the disclosure of information that is privileged or confidential pursuant to the law of this state or the United States or not considered a public record within the meaning of Chapter 132 of the General Statutes and subsection 6 pertaining to personnel.
Okay, this is a readiness report. I don't understand what it has to do with personnel. I mean, I'm not trying to be difficult here, but
I'm assuming that's one of the reasons you
Yeah,
wanted
there's
that
some
part
of the
moved
things
up there.
that I
Plus,
probably.
there's another
And there's
item
some
that
other
we
things that
have.
we'll be discussing in closed
okay,
session.
what is the other reason you're going into closed session then?
We're doing investigative reports and we're looking at those which will disclose confidential information.
I think we need to let our attorney put our speech.
I would be happy to take you into closed session, and it might make sense for a brief recess, because I'm not aware of the reasons why you are intending to go into closed session, and so maybe if I could speak with the chairman or speak with the board if you want to take a
Okay.
brief recess.
I think it's good.
That'll be fine.
All right.
Okay. Okay.
We're in recess.
Recess
for
is so ordered.
Yeah,
5 minutes, 2
5
minutes?
minutes.
5 minutes.
Okay. Ms. Gallagher?
Thank you, Mr. Chairman, for taking a moment to consult with me about the basis for today's closed session. As I understand it, there are really two components to what the board wants to discuss today. One is a readiness assessment that was prepared by the state. That, after we've discussed, will be discussed in open session. That report itself is a public document and will be discussed. To the extent, however, that after review of that report, this board would like to consult with the director with regard to particular personnel matters that involve names of individuals and/or their performance and their positions. That may appropriately be done in a closed session pursuant to North Carolina General Statute 143-316.11A6, which reads to discuss matters related to, bring my glasses up, to consider the qualifications, competence, performance, character, fitness, conditions of appointment, or conditions of initial employment of an individual public officer or employee, or prospective public officer or employee, or to hear or investigate a complaint, charge, or grievance by or against an individual public officer or employee. And so my understanding at this point is that you will discuss the readiness assessment itself now, and if your discussion takes you to the point where, and in open session, you will not discuss any individual names or positions in your open session discussion of the readiness report. If thereafter you wish to continue discussion, and that does involve the names, performance, or qualifications of particular individuals, then it would be appropriate at that time for a board member to move to go into closed session pursuant to subsection 6 of the general statutes. If that motion is seconded and approved, then you may talk just about that individual personnel matter or matters in your closed session. Return to open session. If there is any action that's taken in the closed session, that would need to be reported out in open session. If there's no action that's taken in closed session, then it would remain in closed session, and if it relates to personnel, those minutes would be sealed.
Okay. Thank you.
Okay. Okay, then.
Thank you.
Thank you for that clarification on that. Okay. And I think you're doing that, Brian?
Yes.
Okay.
Okay, the purpose of this hard launch readiness assessment is to determine the agency's readiness to move to the next phase of implementation of NC FAST, which is conducting all Medicaid reviews in the NC FAST system. There are areas of concern on the report, and I'm going to cover each of those, go over each of those, and talk about what we've done to this point to work on them and what's in process now. One of the first concerns was the number of vacancies that we have had in the income maintenance section, and we've talked a little bit about that already today. We did have it down to one income maintenance caseworker position that was still not filled. We have 4 who are starting today, and then we had 1 left to fill, and as Mr. Perry said earlier, we got an email Friday afternoon that somebody that was planning to come to work today reconsidered, and that'll leave us another position to fill. So we have 2 caseworker positions in the division which need to be filled. There's a question about how we will handle attrition. Any attrition that we have, because we're in a better place now as far as not having so many positions vacant at one time, it should allow us to be able to fill those positions more quickly, because we have had multiple positions vacant at one time, and when we do promote people internally, when people do make moves in the agency, it's a good thing, but it takes more time to get the positions filled, because when somebody is promoted, you're back to filling another position. Our plan for training new hires after the hard launch, there's a question about how we plan to do that. Supervisors are now conducting policy training in the areas of food and nutrition services, and also we have one of our temporary employees, who is a retired supervisor, is providing training in adult Medicaid. The supervisors will continue to provide the training in the policy areas, and we will have 2, but we already have one of our on-site support employees from the state who is experienced, has training in the area of NC FAST and navigating the NC FAST system. So she will be providing the training in our computer lab to new hires as far as the NC FAST system itself. One other thing I would like to mention is some of our people that are taking the full-time positions have worked with us in the temporary capacity. Some of the temporary employees that we hired have been hired into full-time positions, so they are already a step ahead because they've already had training because of the function that they're providing. And in a few minutes, I'm going to talk about what the temporary employees are doing to help with the intake process and processing applications. So if you go to page 2 of the readiness assessment and page 3, the concern of backlog we have with applications and the backlog that we have with Medicaid reviews. In food and nutrition services, we brought those cases for review into line, and clients are receiving, the ongoing cases are receiving their benefits on time. So this just applies to applications in Medicaid and food and nutrition services and to reviews in Medicaid. As far as the intake processing plan, we have a plan in place which addresses the current process of taking and processing applications, as well as applications that are past due that need to be processed. This plan was put together by our Economic Services Stability Work Group. That work group is made up of the income maintenance supervisors. We have 2 lead workers as part of that group, and we have 2 line workers as part of that group to come together to bring input from the staff and their own experience to help us when we put the plan together. There is a lead worker from the intake side of the division, and then there's a lead worker and line worker from the review side. So we get everybody's perspective in this plan. The plan that we have in place now is that we've divided into only taking applications and then just processing applications. Previously, the unit was set up so that when you would take an application, you would also keep it and process it. But the input we received from the employees and the supervisors, given the number of staff we're working with, they feel like it's better to divide the duties even more and have just caseworkers just take applications and just process applications. So we have 7.
Excuse me,
yes.
you said take the application.
Take application and then some.
And then process it?
Yeah, a separate
Okay.
a separate worker will process it.
Oh,
Will be
okay.
passed on. So we have 7 caseworkers assigned to intake. We have 10 caseworkers assigned to processing. 4 of the 10 are processing past due applications. We found with working on our reviews that it was better to assign past dues to a specific group and let them just work on those. That allowed us to get those done more expediently than if all the past dues were passed out to everybody. Let each worker focus in one area. We are using temporary employees to conduct telephone interviews for the electronic applications we're receiving and the applications that are mailed in and are dropped off in the agency. So the 7 that are on intake are going to be seeing clients that come into the agency. The temporary employees are receiving the ones that are done electronically, the ones that are mailed in or dropped off, and because they have to make telephone calls and conduct those interviews by telephone. They have to actually talk to the client by phone. The temporary employees are also prepping applications, whether they're past due or whether they're current, to assist those that are processing. So what they're doing, they're running on lines, the verifications that we have to do, some of the prep work that they can do ahead of time before it goes to the processor to help speed up the process. That's one other step that the processor does not have to do. For our redeterminations that are past due, the plan in place.
Which box is that?
I'm sorry. That is under on page 3 under processing times.
Mm-hmm.
Those are and we're talking about Medicaid reviews. Medicaid reviews, in the review unit, the review workers work on reviews only. They review the ongoing cases, and on Tuesdays and Thursdays, these employees are given an assignment of past due reviews. The assignments are handed out by the supervisors, and the supervisors follow up and track the work that's being completed. On Mondays, Wednesdays, and Fridays, they're working on current redeterminations. One thing that's mentioned in this report that's going to help, and it's a statewide thing that will help all counties, is that the state has extended certification periods for the majority of the family and children Medicaid cases. So in the months of December, January, and February, we are not having to, the only reviews we're having to conduct in family and children's Medicaid are the medically needy cases, and which are called MAF, medically needy, which means those are cases where people had been over the income limit, but they were able to meet a deductible. All the cases where people qualified in family and children's for Medicaid and were under the income limit, all of those cases have been extended by the state to the end of February. This allows us
So we have some extra time.
much more time,
to do
that's
that.
right.
Okay.
In those 3 months, we have more time to work on the past dues because we're not having to conduct reviews in December, January, and February on those cases. So that gives us more time. And I've already mentioned that in this program that the supervisors are specifically handing out the work assignments to each caseworker and are following up. Now, if we move on to the security, and I'll tell you what page that is on.
3.
Is that
Page
Page
3.
three.
That's on page 3. The next is on page 3. Assigning user IDs. One of the concerns there was that we did not have a backup to provide those user IDs and to work with that when the NCFAS system administrator or the backup person had not yet been trained. But that has been completed. Our target date, that was completed before the target date of November 30th. I have verified that the second person, that is the backup, does have the training for that and is in place to do that. And then the last concern was on page 9, system-generated tasks. How we are going to track and monitor that the system-generated tasks are being done. Right now, the majority of the system-generated tasks through NCFAST are in food and nutrition services. This could be something like if a client received an underpayment, there's a flag there that the case needs to be looked at. Or if there's an overpayment, there's a flag there, a task that has to be followed up on and generated. Our plan for following up on system-generated tasks is that these tasks do go into the individual employee's queue through NC-FAST. The supervisor assigned to that employee is responsible for checking and monitoring to be sure that the employee is completing work that's in the queue and is following up and seeing that these system-generated tasks are being worked. That is what our plan is, and so it will be up to the follow-up from the individual supervisor. So each supervisor is responsible for his or her employees as part of their regular supervisory duties to see that that's being done.
In that last point, system-generated tasks, I think you were talking about.
Right, yes.
That's kind of like computerized quality assurance. If something's missed, the computer kind of does that.
It gives you a task. If it recognizes something that needs to be addressed, a task comes to the queue and then the employee follows up on it. There was just one other thing I wanted to mention about our intake plan. What we're doing is when people apply for food and nutrition services, sometimes they qualify for emergency benefits when they make the application. And that benefit has to be received by the 7th day after they apply. So we have a lead worker assigned to track these applications where somebody would receive expedited benefits. And that's another area where the temporary employees who have come in have been trained to be able to handle the expedited application, and the lead worker and one of the lead workers in the intake units will be following up and tracking to ensure that these are being done timely and working with the temporary employees to get that accomplished. That was one other part of that's part of the intake and processing plan that we've put in place.
Okay. All right. One of the things that I did is I went through every box and just counted them. So roughly for a scorecard, we have 35 boxes, and there were 5 that had issues with them, which overall is pretty good in terms of getting to a lot of different areas that you did have to cover, and that's a lot of issues that that you were able to focus on. How do you feel about your plan to get rid of the backlog and to handle that?
I feel like it's a sensible plan. We've divided the duties. We have follow-up. We meet weekly. We've been meeting weekly for a long time. We meet weekly with the Economic Services Stability Work Group, and then we meet weekly with the NC-FAST Planning Committee. So on a weekly basis, we're meeting as a group. I think that the assistance, we are getting assistance from the temporary employees to help in these areas. They are helping in these areas. And one thing that's going to help us greatly is the fact that with the reviews, December, January, and February, all of the high volume of reviews we would have in Family and Children's Medicaid is going to allow us to move forward and get that better in line. And of course, our state liaison, they're looking at this because to determine when we actually do go with hard launch, because any time between it could happen any time between January and March of next year. Those are the 3 months that we're mentioning. Of course, they're gonna follow back up again to see where we are on this before they give us any idea of when they will allow us to do the hard launch.
Okay. All right. Any other questions?
I'm curious to know, in the test of this Medicaid part of NC-FAST, our launch, I'm curious to know if there's anybody who has, I won't call it the guinea pig, the prototype, or have tested out before we go.
There's 4 counties that started the hard launch today.
Oh, 4 of them?
4 counties.
I know they were talking about there would be. Are they similar to ours, or?
I think Carteret, Dare, Orange County,
Johnston.
and Johnston. Those are the 4 counties
So
that,
Orange is basically
Yeah.
with them.
those are the 4 counties that went live today.
I'd be curious to know how they,
Explain that to me, maybe to us, on what a hard line is and so forth.
The hard launch means that when we go into a hard launch, that phase, which is reviewing Medicaid cases, that is being rolled into what we're already doing. So that means that at that date, say for instance, it's March 15th, if that's the hard launch date, from that date forward, all reviews have to be completed in the new NC-FAST system.
All right, are you saying then these 4 counties that you've just named have already done this and now moving on?
They are starting the hard launch today, where they're doing
So they
Medicaid. from
completed
the
what we're talking about.
No,
They'll start
they
again.
start, they are
Yeah.
the pilot counties, they are testing the Medicaid system to make sure it works. And then they would do the test on the system, anything that need to be corrected. They would use those 4 counties to make sure that the pilot is working correctly, everything is going according to plan before they move to the next phase of putting more counties in it.
that's the guinea pig.
How do they stack up on NC-FAST pertaining to the food stamps and to the Medicaid?
In order for them to be a pilot county, I would say that they're doing everything they need to do as for having
So they're
reviews.
completely up on the crossover, so to speak, as you're saying there?
What you mean by crossover? You have to define.
The combination of the two. On food
I
stamps
would
and
say
Medicaid.
that when they go to this thing, then they would be doing all of it in one system. So
Yes.
this is the first step in everyone, what we call being a universal worker. So this is the first phase of the universal worker, is by them being able to do the hard launch for them to test food and nutritional service Medicaid together.
They are up enough that
Right.
they are identified as a pilot.
Pilot
The
county.
test
Yeah, y'all, I
county.
understand that.
Okay.
Yeah.
All right.
On that, but I just wanted to know how do we stack up with them? Maybe that's why I'm kind of coming to.
I'll say that we are not where we need to be, because if we were, we would not have redressing the backlog and
Right, that's
overdue,
what,
so.
that's what I
Yeah.
had figured
Okay.
too, George.
Mr. James, I had asked the state to, where we stack up against the other 99 counties in terms of this readiness assessment we have here. Have not heard back from them as to how our progress compares.
When do you think you will get that information, Mr. Manager?
I had requested this back when we got this 3 weeks ago, plus I can follow up again.
Okay, all right, okay. Well, what I'd like to do is, get a motion to go into a closed session at this
Do we
point.
read it beforehand or afterwards?
Well, I
I think
think,
she's already,
And I gave the language to it, Ms. May.
okay,
General Statute 143-318.11, subsection 6, to consider the qualifications, competence, performance, character, fitness, conditions of appointment, or conditions of initial employment of an individual public officer or employee or prospective public officer or employee, or to hear or investigate a complaint, charge, or grievance by or against an individual public officer or employee.
Move we go into closed session based on the information read.
second.
a motion has been made and seconded. All those in favor? Aye. All those opposed? Okay. Okay, yes, we're back into, closed session at open session now.
Mr. Chairman?
Yes.
I'd like to make motion that we adjourn.
Second motion.
Motion has been made and seconded. All those in favor say aye.
Aye.
All those opposed? All right.